Colleagues, good morning. Good morning, everyone. Honorable members, very good morning.
Chair.
Thank you. Thank you.
Morning, Chair.
Good morning. I want us to start. Albertina, can you please show us the agenda? Okay. Okay, I hear you. David, please mute.
I am muted, Chair.
No, you're not. It's only now that you muted. Colleagues, thank you very much. Let me welcome you to this meeting this morning and open this meeting officially. Welcome everyone who's here. I'm trying to check who else am I missing. Uh-oh. Okay, officials from the department and Team Parliament, you are welcome. We have two agenda items today, colleagues, which is the normal briefing on the foot and mouth disease. And then the second one is the briefing again by the department on the National Agricultural Marketing Council, the review of the Marketing of Agricultural Products Act of 1947, Act 47 of 1996. Can we then take apologies, Albertina? Albertina, apologies.
Yes, thank you, Chair. Good morning, Chairperson. Good morning, members and colleagues and everybody on the platform. Chair, today we receive apology from Minister. Minister is participating, attending in SA Investment Conference hosted by the President in Sentin. UDM Kapa due to bereavement, Chair. And UDG Ramasodi is also has apology for UDG Chair, but UDG Muzunga will be the one who's going to lead the delegation, together with Dr. Modisane, Mr. Gelembe, and Dr. Ngamakwe from NAMC. Thank you, Chair.
Okay, thank you very much. Honorable members, is there any other apology you want to bring to the force before we continue? Okay, there is no hand, so it means we are cool. DDG or Dr. Modisan, you should be the one who's updating us. I want to believe so. But let's give to the leader of the delegation today, of the team today, which is DDG Mutunga.
Good morning. Good morning, Honorable Chair and honorable members. We will be, as requested, be updating you on our interventions on FMD, and also then be updating you with the progress on the amendment of the Marketing Act. With me, I've got sorry, Chair. I was trying to move to another gadget.
Okay.
So with me, Chair, I've got
Hotel, I don't know whether you are muted or we've lost you.
so with me, Chair, I'm with Dr. Mdisane, who will then be giving us the presentation on the progress first on the FMD status. Thank you, Honorable Chair and members. Dr. Mdisane.
Thank you, TDG. Dogotela.
Thank you very much, Honorable Chair. Good morning to honorable members of the Portfolio Committee, DDG, and other colleagues. This is going to be a normal update on what is happening regarding FMD control, and also maybe an update on other issues related to the management of foot and mouth disease. Thank you very much. The next page, please. If you go to the next page, is an outline of our presentation. Next page is an update on the current situation, with the understanding that all the time we try to capture the new reported outbreaks in certain areas that have been confirmed by diagnosis. At the last time we reported that there were challenges in Crichton Valley in KwaZulu-Natal. We provided an additional 15,000 doses of vaccine to handle the outbreak. And up to so far, there hasn't been any new cases in Crichton Valley. In KwaZulu-Natal, we believe that the situation has stabilized to some extent. In the Northwest Province, new cases were reported in Dr. Ruth Sokhomotso Mompati district. We also allocated 10,000 doses from the emergency stock that we kept to handle the outbreak. Limpopo has reported quite a number of new outbreaks in Mudimole, in Makado, and in Sikukuni. We have provided Limpopo with 10,000 doses, but they have requested an additional 20,000 doses. We are going to be giving them additional vaccine to handle the situation. There hasn't been any new cases in Northern Cape. The last reported case was in Douglas on the 24th of March. And we also realized that they still had, even if we had not given them a lot of vaccine, they still had vaccine that could be used in other provinces. And then we took 10,000 doses away from them and provided it to, in particular, the Northwest. The last time we reported a new outbreak in the Western Cape, around Philippi. There hasn't been any new cases reported since we had that report on the 24th of March. So even if it may be premature, we believe that we will be able to maybe manage the outbreaks in the two Capes, the Northern Cape and the Western Cape. We still have to conduct surveillance to detect new cases. Next slide is the map trying to depict the new outbreaks in particular provinces. It is very clear that in the Northern Cape there hasn't been that many outbreaks, and similarly in the Western Cape. Concern, however, is that we can see that new outbreaks are being reported in the Eastern Cape and many in the Free State, and an increasing number in Limpopo. Next slide. The next slide is a table that depicts the number of confirmed cases, only confirmed cases, laboratory confirmed cases. We are now standing at 1,223, indicating the numbers that have been reported in each province. We can see that Northern Cape has only reported 2, and then Western Cape has only reported 13. But there are, Limpopo has up to so far reported 46, and Eastern Cape has reported 69. Next slide. And we try to add additional information on this slide, depicting that to date, from the 2,500 to 2,500,000 doses that we have received to date, as at 26th of March, we had vaccinated 1.7 million head of cattle. Honorable Chair and honorable members may remember that 2 weeks ago, there were torrential rains, especially in the Free State and in other provinces. So that those rains really delayed the vaccinations significantly, but the numbers have picked up since the rain stopped. From our calculations, we see that we are left with only 763,000 doses. But Honorable Chair, I can emphasize that from the reports that we are receiving from the provinces, some of the vaccines that are depicted to be in balance have been issued to the private practitioners who have not provided reports as to the usage of the vaccine. So we'll be paying attention on that, because we believe that there could be more animals that have been vaccinated, adding the numbers by the private practitioners, and then much fewer doses of vaccine that are left. From the data, we can see that some provinces have very little vaccines remaining, with the Northwest only remaining with less than 5,000, and Western Cape having about 7,000. Even Limpopo basically only has 10,000 doses that are left. Next slide. The good news, Honorable Chair, is that the ARC, as promised, they have now produced the 20,000 doses of monovalent SAT2, and they will be handing it over to the department today, which is very good news. Where do we stand in terms of additional orders? We have ordered an additional 1.5 million doses from Biogenesis Bago, the Argentinian company. The order has been issued. The SAPRA permit, Section 21, has been issued. The Section 6 import permit has been issued. We are just waiting for the vaccines to arrive now. And the other good news is instead of having bivalent SAT1 and 2, Biogenesis Bago has also added now SAT3, the third variant of the Southern African Territories virus on their vaccine. The other company that has been supplying us, Dolvet, SAPRA permit has been issued. The import permit has been issued. They are busy manufacturing, and there is an indication that by mid-February, by mid-April, we'll be having an additional 2 million doses from Dolvet. So in the coming 3 weeks, we'll be having an additional 3,500,000 doses that we are going to be using. And I can confirm that, especially for the Dolvet vaccine, the SAPRA, South African Health Products Regulatory Authority, has given a permit for 6 million doses, but they indicated that we will have to import it in batches of 2 million doses to avoid disturbances in the cold chain. Next slide is the other processes that we need to complete in terms of the foot and mouth disease management. Before the mass vaccination campaign, a disease management area was declared in KwaZulu-Natal. It is no longer necessary for us to maintain the disease management area because the whole country will be having a similar status to the status in northern KwaZulu-Natal. So we are in the process of dismantling the disease management area that has been gazetted in KwaZulu-Natal. Because the country's status in terms of the foot and mouth disease has changed, the department is in the process of amending the contingency plan. Discussions had already taken place to look at areas that needs to be amended, and then it is still being discussed further. We will be reporting to the committee on progress regarding this one. Minister intended declaring a Section 10 scheme, which basically had been finalized for purposes of gazetting, but legal services made comments in terms of legality of certain clauses. And then we are re-looking at the proposals from legal services, and it will be finalized very soon. It is also very important, honorable members, to look at aspects of animal movement control. which was discussed extensively yesterday at the meeting of the veterinary working group. In other words, looking at movement of animals from province to province, from farm to farm, to avoid the spread of the disease. So we'll also be updating the portfolio committee on this aspect. The last issue is employment of additional personnel to assist also with vaccinations and then surveillance for the disease. The provinces are busy working or doing work related to employing additional animal health technicians. That will also include employment of additional veterinarians. And the national department is also, together with the ERC, finalizing the appointments of these additional colleagues. Next slide is the recommendation page, where we are recommending that the committee should take note of progress that is being made related to vaccination against foot and mouth disease. Thank you very much, Honorable Chairperson, honorable members.
Thank you, Dr. Matisane. I'm trying to open my okay, then I'm fine. Dr. Motsonga, you didn't tell us as to you are DDG for which branch. We have not been introduced to you as a DDG.
Thank you, Chair. I'm standing for Mr. Serache, who is the DDG of Agricultural Production, Biosecurity, and Natural Resource Management. So I'm just acting for Mr. Serache, who is on leave. Thank you, Chair.
Okay, no, thank you very much. I thought they said DDG. All right. Honorable members, there is a presentation before you. I will see by show of hand, I see Honorable Aris Nyambose and Honorable Trolley. You can start, Honorable Aris.
Hi, good morning, Chair, and thank you for the presentation. Good morning. Chair, I have noted a steadily concerned increase in cases from the 2nd of March to the 27th of March. The department was, what explains the sharp increase in outbreaks between that period? And we also would like to know, are there undetected or unreported outbreaks in rural areas? And then, is the current vaccination strategy focus on containment, suppression, or eradication? And we would like to know what criteria were used to determine vaccine allocations per province, because we have seen in the presentation that they allocate to the Northern Cape, and then they took from the Northern Cape to give to, I think, Western Cape, because there was an outbreak there. So they must tell us what criteria they use to allocate this vaccine, and what is the estimated economic impact on farmers and livestock industry. They need to tell us, because they bring the presentations every week, but they are not giving us the economic impact it has on farmers, and how many farmers has been financially affected or lost of livestock, because the department needs to start doing that assessment. And then, Chairperson, I will continue asking this question, because I want to know what's the progress on compensation of farmers that lost their livestock? Thank you.
Thank you very much, Honorable Nyambosa.
Thanks, Chair, and greetings to fellow portfolio committee members, and greetings to our DDGs present and officials. Mine is to say thanks for the updates so far. We are seeing that there is an upswing in terms of the infection in some of the provinces that were not part of the focus, like I see Makado, Modimule, Sikukune, which is a new thing, and I see also Sukhumutsi, Mompati district, that there is an outbreak there. And then the question is, there are two things that we need to then monitor. I saw the animal movement control issue being discussed, because each time there is an upswing, there has to be an explanation. What is the variant factor that leads to the new infection or new outbreak in new areas that we have not talked about? And it's part of the monitoring that will request the department to be progressive and consistent in monitoring, because it's telling us there is a movement of animals, but undetected. And if it does pass through the authorities, which means there is a relaxation of rules and regulation in terms of movement of these animals, I think it's something that I'm observing and noting. And what is the implication of the lifting of the KZN disease management area? Does that mean people in KZN can now enter an era of normalcy wherein now they can move, or what can they do in this lifting of the management area in KZN, because they have been suffocating a lot in terms of doing business and going on with their farming? May I also find out what is the status of the case that was lodged by some of the animal or farmers in the Free State, especially? What are the implications of that outcome? Because it is likely going to introduce something new whereby private sector would want to administer the doses or the vaccination program. Does that then apply to other non-private sector organized bodies like your communal setup? Can they also now be given that? And what guarantees do we have that everything will be administered according to the rules and the protocols of the outbreak of the disease? The other last question for me, can't we use also this outbreak to move towards inclusion and integration in the sector of agriculture, public and private sector? Because we now see that when the outbreak actually happens, it affects all of us irrespective of our exclusions and parallel structures that we are having. But when we intervene, we should intervene jointly, wherein we now realizing that we need certain elements which are falling under other departments so that we can work together, but that being a progressive transformation agenda because of this disease. Let me stop there, Chair. Thank you.
Thank you very much, Honorable Trolley.
Thank you very much, Chair, and thank you to the presenter. First of all, I note that the department says that they've vaccinated 586,000 animals in the last week since we met on Tuesday last week. And if that's the standard of 500,000 a week, it's going to take us a long time to meet the objectives of the department. The next issue that I want to recognize there's progress, albeit slow. I am concerned that last week we were told that the arrival of the 1.5 million Biogenesis Bago vaccines was imminent any day, as was Dolvet, but the status appears to still be the same, that we are waiting and that they're being manufactured, which means that there's going to be a hiatus. If that vaccine doesn't arrive in the next day or two, we're going to fall behind. So that is a concern. I'm very pleased to note that the ARC has manufactured the first 20,000 doses. And I hasten to add, Chair, that I still don't have a coherent response from anyone in the department around the first batch of 12,900 ARC monovalent vaccines that were announced and distributed after the 6th of February. I did ask, was that from a previous batch? Because there has not been a facility available to produce vaccines, and no one has been able to answer coherently about those 12,900 vaccines, whether they were produced in 2023 and whether they were being held as an emergency stock, because I just can't understand why they were not applied previously, but maybe we'll get that in due course. Then, Chair, I would like to make some comments, and I'm really sorry that the Minister and the DG are not present, but I'll make them because they'll be on the record. Everything we say in these committees is recorded.
Yes.
I did advise the Minister last Tuesday that the President of Agri East Cape had written a public statement saying that when foot and mouth disease frustrations leads to litigation, despite there being two ministerial task teams, the Ministerial Task Team and the Industry Coordinating Council, litigation still went ahead. He was concerned about that. And he said that there are clear reports received from the ICC that there is no coordination between the departmental officials, the ICC, and the MTT. And the Minister at the time said that he couldn't understand that because Johan Kotzer represents the Eastern Cape Agri on the ICC. But I mean, the fact is that Peter Clutie wrote that. And then he went further to say that there's only one person responsible for the coordination of this, and that is the Minister. I then asked whether the regulatory framework is going to be changed, because we're still operating in a regulatory framework that is applicable to the old dispensation of foot and mouth free disease status, where we were controlling sporadic outbreaks. That has now changed with the comprehensive vaccination campaign. The Minister assured us last week that there are more than enough doses of vaccinations to vaccinate the animals that are needed to be vaccinated in priority areas and for follow-ups. And it appears that the follow-up doses and the new orders are still on back order, which is a concern, as I stated. Then, Chair, what really did surprise me was that on the day of our last meeting was the day that the court case commenced between Sakaliga Sai and Agri Free State against the department. And the Minister made no mention in that meeting or prior meetings that the department and he were coming up with a Section 10 intervention. And this matter was raised continuously in the ICC by the representatives that we need to have a Section 10 intervention. The court then ordered that the Minister must come up with a Section 10 scheme in accordance with the Animal Diseases Act and make it public by the 17th of April so that the parties can scrutinize the scheme, and then it will appear before court on the 28th of April, and that the system should be able to withstand scrutiny, should be effective and efficient implementation of this vaccination campaign. There was a cost order against the department due to the fact that the department was responsible for the matter appearing in court. And it's quite interesting that there were 12 respondents cited in that court action. And the court waits an outcome to see whether the scheme will be expanded to include more private participation or whether that it will continue under state control. Then I think it's really important for us as a committee, Chair, to understand what the judge said. The judge reprimanded the Minister and the department for their late filings of the Section 10 scheme. And he said that it was amazing that there was a sudden discovery of urgency. And I want to quote what he said: "When death knocks at the door, then presto. And suddenly, when the shoe pinches, all kinds of things are done." Now, Chair, this is what we've been calling for all along as a committee, and myself in particular, saying that we must come up with a scheme that includes and incorporates all stakeholders and farmers themselves who are able to vaccinate their animals because they do so on a daily basis. And then what perturbs me is that the minister claimed victory in public, and the next day in Parliament, he said when answering questions about the foot and mouth outbreak that I had received a shellacking in the committee. Now, a shellacking means a severe and comprehensive defeat. I don't recall receiving any severe and comprehensive defeat in the committee. But what concerns me most is that there's a personalization now in this committee between the minister and myself. And it's unfortunate because I don't represent myself in this committee. I represent the committee and I represent constituencies that are affected by foot and mouth disease. And it also came to my attention that the minister's parliamentary liaison officer is recording me whenever I speak in a committee or on oversight meetings. Now, I really don't mind about that because what I say is on the record in this committee and what I say in oversight meetings is also on the record. But I do take exception to people recording me without my permission and without informing me. And I want to put that on the record that I take grave exception to that. And we must avoid this personalization that is happening in this committee because it will pitch the committee against the minister. And then we will have a confrontation that's not going to be constructive. Thank you, Chair.
Thank you very much, Honorable Trollip. I think it's fine that you raised this matter even in the absence of the minister, because indeed it's recorded. But two, there is a delegation here that comes from the department. My take is that they have to report every time they go back if the minister is not here. It is just unfortunate that the DG is not here and the two DDGs are not here. I see there is no DDG Komape is not here unless if I missed it. And we were not told as to what is the apology of DDG Saraje. Dr. Mutsonga, you'll come back and be able to appraise us on the two DDGs, especially because the second item that we have on the agenda it falls under DDG Komak. It is very unfortunate, honorable members and Honorable Trollip in particular, because you've raised this matter, that we consistently recently have found that in the committee the minister just concentrate on one member, and when you ask questions it becomes very personal. And I think I thought it's something that was just going to be a once-off thing, because now it has become like it's consistent. In the last meeting in particular, it was getting worse because the minister was now refusing to answer questions that we ask, and it becomes very, very particular and personal. And I have noted that even in the House, if you were to ask a question, it becomes very personal. The response becomes very personal, and it's actually embarrassing at some point. We will wait until the minister comes back in the next meeting, and we'll raise it, Honorable Trollip and Honorable members, because I thought that we were working very well until this foot and mouth disease, and then the relations are now changing, and I don't think that it's correct that one member should be targeted. Again, on the recording, of course, it was also brought to my attention and I tried to speak to Sihle. I just wanted us to speak to him informally in a meeting, because of course, as you say, there's nothing wrong with recording somebody if somebody knows that you are recording them and knows what you are going to use the content for. The unfortunate part is that I had raised this matter when we were in the Free State, when I saw people recording, and I made it clear that when they record, it must be for a good purpose. We can't record people speaking and we go and take it somewhere where people don't know, including social media, because recording one person and leave the other people, the context may be erased, because the person who's going to listen to a person who's speaking or responding may not know what was said before. So if you get information out of context, it's very dangerous. And I'm always very wary about people who record meetings and content of meetings without having requested and without members knowing that there's a recording going forward. And I think you did well, Honorable Trolley, by raising it. I had raised it, unfortunately, in the Free State when I raised it with other members who have also observed. When I raised it, I found that all the other members have observed the recording thing. So we discussed it in the meeting before we left the Free State, and unfortunately the official had left, but I requested him to come back and I indicated that. So my take is that it's not going to continue. If anyone wants to record a member or any person, we will be notified so that we all know. And I don't want to speculate as to where were these recordings going or what were the recordings for. And maybe the official at some point will be able to tell us what was the content for. I see there's a Zoom user. I don't know who is Zoom user. If we can get a name and just change that Zoom user into a name. If you can check on the platform at the end, towards the end, the Zoom user and the Zwelakhe. Okay, so Zoom user is gone now. Nhlanhla and the team, who is Zoom user? Who was it? Because just as I raised it, Zoom user just got out of the meeting. Did you remove him or her, or did they remove themselves?
Yes, Chair. We actually, as the team, do not know who Zoom user is, so we are not admitting them. So I don't know how they got back in, but I have removed them myself. Yes.
Yeah, you should be very careful because Zoom user have been here since we started. Okay. People must identify themselves because there's nothing wrong with attending meetings. We just need people to be identified with their names. Well, colleagues, I think you may want to comment on the comments that Honorable Trolley made. If you want to do so, I'll give you an opportunity once we've allowed Dr. Modisane to respond and the team to respond to the issues and the questions that were raised. And then you will then come back so that we can discuss this matter before we go to the next item.
Chairperson, no.
Okay. Oh, Honorable Aris, you want to speak? Go ahead.
Yes, thank you very much, Chairperson. I'm actually glad you raised this issue of the minister because it was quite irritating for us the way how the minister disrespectfully responded to us as members. And I strongly feel that you need to bring it to the attention of Cabinet, and you as the chairperson must write to Cabinet so that they can address this minister, so that when he come to this portfolio, he must not come with attitude, because we all could see that it was a personal thing that he was having with member Trollop, and the portfolio committee meeting cannot become the battlefield to sort out his petty squabbles that he have with Honorable Trollop. Thank you, Chair.
Thank you very much, Honorable Aris. Honorable Nyambos.
Yes, thanks, Chair, for giving us here a chance. Well, I think we've observed, and probably not just in the recent past, but for almost the longest time. So my assumption was that it's something that probably would have taken place somewhere before coming to this seventh administration, the way when you detect the undertone. It may be really personal and political, but now it is setting in even in the neutral platforms where we are all supposed to be working. And yes, it does impact on us because now we have to decide to take a side to defend one of the member against the minister, which the minister also is actually supposed to be accounting to the portfolio, which may actually disrupt the performance and the movement of things. The question is then that is it a matter that we can ask both parties to take us into their confidence of any hindsight or gray area that we might be having as a portfolio, so that when we support, we don't support unconsciously or blindfolded, that it's a matter that may have to do with the work stream of the portfolio, so that at least once we are in the know, then we'll know that we need to attend to this matter or we should be joining in. But yes, we do see that it impacts. And may I cite the reasons that we have a precedence in the cabinet where you had a minister who probably behaved in a manner that was untoward to the portfolio, which led to a pressure being put on the minister to eventually being removed from their portfolio. So this, if it is really going on like this, it should be reported so that steps should be taken if someone is at fault in attacking the person of another individual. Thank you.
Thank you very much, Honorable Nyambose. We will not ask the Honorable Member Trolley to explain. We may want to ask the Minister because it started from the Minister, and it's making it very difficult even for me to chair a meeting because I'm not very sure of what actually is happening when the Minister just gets turned off and not even want to respond to questions. It becomes very, very difficult. So we will not do that, Honorable Honorable Cholip has always been asking questions like all other members, and it is our right as members of Parliament and as members of the Portfolio Committee to respond, to ask questions to the executive, because we oversight on the executive. The fact that sometimes the executive is not there, and we take the the officials' presentations and responses does not make it, or it does not mean that the portfolio committee oversight on the officials. We just take it because they are the support team of the minister, but in essence, we need the minister to be the one who is here and who is the one who is supposed to answer questions. So we will not want to go and find out as to what you are saying, Nyambozi. It's not part of our work. Our work is that when the minister is here and the team and they make presentations, we will ask them questions. The same way that we address the minister with respect and professionally, we expect the same from the Honorable Minister, to be able to address us and be professional in his responses or engagement with the honorable members. That is something that is known, and the honorable minister knows, and that is why we always respect him. And I think that he owes us that same respect and professionalism. But it's something that we'll raise with him. I'm glad that it's recorded. We'll pull out the minutes and we'll tell him when he comes that this is what we discussed. The minister is supposed to account to this committee, the members of the committee. And therefore, the minister can't choose which members he would like to respond to and which members he would not want to respond to, which is what I told him last week in the last meeting. And I understand the feeling of Honorable Trolley. Of course, I would feel the same, and that's why last week I told the minister to treat us with respect the same way that we do. But we will continue to raise it with him. It is upon him to realize that he has a responsibility. His responsibility is not only to run that department, but also to come and brief Parliament, because this portfolio committee represents Parliament. So if the minister does not respect this portfolio committee and the members, it means it's translated to the minister not responding to Parliament and not respecting the Parliament. But it's something that will raise, and it must be noted. Honorable Trolley, I feel bad. I'm sorry about this situation, but we will handle it when next the minister comes. We will address it first before we continue with the meeting, so that it's something that it will be noted as an issue that was discussed in the committee and recorded properly. Thank you very much, honorable members. May I take Dr. Mdisane, please, if you can respond to the questions.
Thank you so much, Honorable Chair. ADDG Mzunga forgot to say that I am with colleague Dr. Emily Mukhajani, where I falter, DDG, Dr. Mukhajani will assist us. But maybe let me start off by saying, Honorable Chair, honorable members, we appreciate the questions that you are asking, but sometimes we often maybe run short of explaining enough in terms of the situation. Before I start responding to the questions, one asked by Honorable Aris and Honorable Nambos, referring to the increase in the number of cases, I would like to take 1 minute or a few seconds to explain that foot and mouth disease is not a very conspicuous disease. There are times when the animals can get foot and mouth disease, and by the time the owner observes the clinical signs, it has already passed. The severe clinical signs of limping, wounds, salivation may not be seen. Sometimes the animals are not seen for a couple of days, and during that time is the time when the clinical signs are showing and they are not seen. So the most likely thing that happens is the farmers often miss these clinical signs. It is only in certain animals, like in dairies, where we see, in dairy animals, where we see conspicuous clinical signs. And then in intensive systems, in feedlots and so on, we can easily see the clinical signs. So it is very important that when we have a situation that we have now in South Africa, we also take time to go to specific animals, do what we call mouthing them and checking in between the hooves if there are any old lesions, and if there are any old lesions in the buccal cavity in the mouth and on the tongue. And quite often that is the time when you pick up that this animal may have been exposed to the virus. Most of the time the animals do not die from the disease, only in specific cases where we have young calves that they may die from the disease. Unfortunately, honorable members, during that time when the clinical signs are showing, that is the time when the virus is spreading. Because the virus is shed through the saliva and shed on the grass, and the other animals that are not sick, they will pick the infection from there. So it is very important in such situations that we go and do that surveillance, and then when the lesions are healed, we have to collect blood and then probably also collect samples from old lesions and send to the laboratory for confirmation. And that is again where there could be a delay, especially if you only have one laboratory that is authorized to do that, which is OVR. And OVR is currently having a lot of backlog because of the number of samples that we are sending to them. And that is why we are investigating possibilities of authorizing other laboratories to do the diagnosis. So the increase in number of cases, question as asked by Honorable Aris and Honorable Nyambos, is related to the fact that we are conducting surveillance, retrospective surveillance. We are picking up new cases that were previously not reported. And then we are also, in terms of laboratory diagnosis, picking up new infections or confirming new infections. The number of cases that we are reporting, as we emphasize in our presentations, it is the number of confirmed cases. There are many other suspect cases that have not been confirmed and that we are not reporting to the portfolio committee. So for lack of a better word, these increases in the number of cases could be real in terms of real time, or they could be retrospective in terms of what we suspected before and what we had reported before. So I don't know, I'm trying to explain the fact that every week we report new confirmed cases. And then in the first slide of our presentation, that is when we also report on cases that have been newly detected, from which samples have not been taken before, that we are taking samples to the laboratory. And then the second question from Honorable Aris is, what are we doing? Are we trying to contain or eradicate? At this moment, Honorable Member, the disease has spread to a very large extent. The strategy at this moment is to contain the disease and avoid it to spread any further. And the vaccines that we are using are assisting us in terms of getting the animals to produce a quick antibody response and prevent further shedding of the disease. So at the moment, we are containing and preventing further shedding and further spread of the disease. If we were eradicating, basically, we would be going the route of also trying to cull the animals. But the strategy is not to go and cull the animals. As we indicated, the animals will be in a position to heal and they will be productive again. Our strategy is based on a 10-year strategy. Dr. Mkhajane may come in when given an opportunity. The first 2 years, we will look at when the babies are born, the calves are born, we will be looking at coming up with an application for freedom without vaccination. So we are going to be vaccinating for 1, 2, 3 years, and then we'll also be looking at slow withdrawal of vaccination. And that is where the economic part of it comes. Since we started this mass vaccination strategy, Honorable Chair, just from the vaccine point of view, we spent close to 250 million rand up to so far. The other costs in terms of the buying of the needles, the buying of the syringes, the traveling of the officials, the SNTs have not been taken into consideration yet. And the Agricultural Marketing Council has started conducting a study, an evaluation of the current economic impact of the disease. And that is where I also said we also appreciate the questions that the honorable members ask, because interestingly, there is also the social part in terms of the slaughtering of animals at the funerals, at the weddings, and that I believe our colleagues from the Agricultural Marketing Council will also be looking at to assist us in terms of answering the questions that honorable members always ask. there is a question on compensation. As I indicated, particularly the SAT 1, 2, and 3s that are giving us trouble right now do not normally kill the animals. And our strategy is not that of culling the animals. So the compensation that government is giving to the farmers at this moment is to assist in terms of spending money to purchase vaccine, and then also assist the farmers in terms of vaccinating the animals. The farmers will still be having their animals going into the future, so there is no consideration of compensation. If it was, for instance, a strategy of culling that, like we used to do when we were free with vaccination, we used to consider compensating in terms of Section 19 of the Animal Diseases Act. But at this moment, that is the strategy that is not being employed at this moment. Honorable Nyambosi also asked on the upswing that I responded to, and then also the implications of the removal of the DMA in KwaZulu-Natal. At this moment, Honorable Member, the DMA may be seen to be disadvantaging the farmers in especially northern KwaZulu-Natal. But at the same time, as we indicated, the provinces, for instance, the Western Cape is requesting that when animals are moved from any other province into the Western Cape, to avoid introducing new outbreaks of foot and mouth disease, the animals should have been inspected for foot and mouth disease. They should come in with a permit. Maybe from the South African perspective, we should have been able to do these movement controls a long time ago, but we only had the movement controls for the protection zone alone, and we didn't have the movement controls for the rest of the country. So the intention is to have movement controls throughout the country, and then legislate that in terms of Section 9 of the Animal Diseases Act. We are also considering, Honorable Chair, to also come up with an even better animal identification system, like the one that we are having at this moment. We only have an owner identification. It will be Modisani having only one mark, BDX. I'm just giving an example, that all his cattle must be marked like this. So we are now also going to have a system where we say Modisani BDX1, something like that, to say that he's got, this is cow number 1 in the whole system. But it will, when that is implemented, there will also be an opportunity for public consultation. And then thanks to Honorable Trolip for recognizing that the ARC has produced some vaccine. But I also would like to emphasize, we will request the ARC to again respond in writing. But what I wanted to clarify to the Honorable Committee members is that the ARC previously had a 20-liter, if I'm not mistaken, 20-liter vaccine production system. that they used to develop a concept note, and then also used to make vaccine that they used to get their vaccine registered. When we realized that we did not have anywhere else to get vaccine, the department asked them what happened to that 20-liter production system. Because whatever vaccine we can get at this moment will assist. I believe that they will be in a position to respond to the question from Honorable Trollip in writing, Honorable Chair. And over to you, DDG Muzunga, and to the Chair. Thank you. I think I responded to majority of the questions.
Thank you, Chair.
Thank you. Is that
I think there is. Yeah, I think there is a question on the status of court case, Dr. Modesane. And I think, Chair, Honorable Chair, on the question of that is asked by Honorable Trolley, we can then request ARC to respond on this question of the 12,900 doses because they are not here. Dr. Mdesa or Dr. Mukhajan on the status of the court case?
Honorable Chair, I think Honorable Trolley summarized the issues related to the court case. I'm not sure if I would be able to interpret it any better. We have been instructed by the court to publish the section 10. But I don't know whether I can comment on that, Honorable Chair. It's a difficult one because this matter that is sub judice, and I wouldn't be able to make a proper legal analysis on that one. Thank you.
No, thank you very much. In future, you'll bring your lawyers, the representative of the, I don't know what you call them, legal people from the department. Honorable Trolley, is that a legacy hand or a new hand? Okay, my guess is that it's a legacy hand.
I beg your pardon, it is a legacy hand, Chair, sorry.
Okay, it's okay, thanks. Dr. Mukhajan.
Yes, Chair.
Is there anything you want to add?
Okay, yes. Good morning, honorable members and Chair. I'm going to add on two things, I think, which Dr. Mlisani mentioned, but I think did not inform you on the challenges. On the movement control, the matter is still outstanding because we got an objection from the auctioneers who are objecting regarding the fact that they were not consulted on the movement control. We are meeting them tomorrow to try and resolve the impasse, and we hope that they will be able to put that forward for amending our movement control permits. The issue on the section 10, just to mention that we are on track. It has been finalized. It's currently under the legal services to ensure that we comply with the legal principles. And we're hoping that I think by Thursday, it will be going over to the minister. The other issue, which I think Honorable Mtetwa mentioned,
was the issue around the DMA. I think Dr. Modisane touched on that. But I think in KZN, we held discussions with them regarding the lifting of the DMA because it results in stringent measures for movement control. However, what occurred is that KwaZulu-Natal feels that they want to expand the movement control, or they want to expand the DMA within the province. We are talking on that, and the matter needs finalization as soon as possible. Thank you.
Thank you very much, Dr. Mukajani. Honorable members, is there any follow-up question? Excuse me. Is there any follow-up question that you would like to make on the responses that came from the department? Nteto. Honorable Nyambos.
Yes, thanks, Chair. Now, on the question of the implication of the case, what I was trying to reveal is that in a case where we are all affected by the outbreak of a disease, but it only matters much those who have capacity can approach the court to petition a particular matter that affects their business. So I was just raising the outcome of that case, whether will it now apply, whatever the outcomes, will those outcomes only be for those who lodged the case, or the consequences of the outcome of a judgment will have an overarching effect wherein even those who didn't lodge, that now they can benefit from whatever the outcome of the case. I was citing that because the industry is separated into formal, informal, emerging, communal. But you find other sectors not being able to petition the department to the point that they comply based on the outcomes of the judiciary. So those who can't approach the court because you need money to sustain a matter in court, then it means sometimes you end up losing. So I was just raising that, will we benefit others who may not be cited in the judgment, that when the department complies with whatever outcome, that we are all gonna, because the implication is that if the private sector are given a right to vaccinate, it means the communal emerging farmers also should be given, because if they are not, then it means this was just done for them because they are able to take the matter to court. So I was asking, are the outcomes going to be shared or are only for specific reasons? But there's no need for an answer, it's just an observation.
Thank you very much. I was actually going to say
can I just get a clarity question, please?
Okay, go ahead.
Yeah. Chairperson, I did hear the response from the department. And in terms of, because my question in terms of compensation for the farmers. But they are, and I mean, I have read the other day also, there are farmers that are saying they have lost everything. They have lost income. So how can they say that this foot and mouth disease is not affecting the farmers financially? Because the department respond to say that it is not that, they are losing the animals totally or whatsoever. But how can they say that? Because now people are forced to, and we did hear that in the public hearings, people are forced to cull their animals, and people are forced to sell their animals at a very lower price. So how can they say? Then the department must go and do an assessment on the impact, because that is what they didn't do. They must go and do an assessment on what's the impact of the foot and mouth disease on the farmers. Thank you.
Okay, thank you very much, honorable members. I don't know whether Dr. I want to come back on the comments by Honorable Aris. But in the comments by Honorable Mteto, I'm glad that at the end you said that was just a comment, because I was going to say to you, we will wait for the courts, and then once the outcome is there, those who know the law will interpret the outcome and we all will know what it means. So for now, we will not speculate. Is there anything you want to say, Dr. Mkhajane or Dr. Mudisane?
Yes, Chair Mudisane. I think, thank you very much, Chairperson, and also thank you, Honorable Aris. It's if we said that there is no financial impact on the farmers, we are absolutely wrong. There is a financial impact, and then I was trying to add that in addition to the economic impact, there is also social impact, and the farmers are affected adversely. So the reason why I brought up Section 19 of the Animal Diseases Act is that quite often when the state's control measure involves going and killing the animals, shooting them, or taking them away, it is only then that there is compensation in terms of the Animal Diseases Act, because it also refers to the fair market value of the animals. But in this situation, majority of the animals are not dying, or a big number of the animals are not dying, and they are not being killed. That is why compensation is not being looked at. And I think we should also remember, Honorable Chairperson, that the department is not working alone in this situation. There are other departments that are being brought in to look at maybe assisting going forward in terms of maybe looking at issues of economic impact and so on. But the most important thing that I wish to report to the committee is that we were speaking to the Free State yesterday, Dr. Barnett, asking him if there are any farmers that ever reported deaths of animals from their farms. He says that he hears it from the grapevines. Farmers haven't come through to say that there were animal deaths. But of course, in the dairy industry, there is loss of milk production. In the feedlot industry, there is stunted growth because the animals are not eating very well. And those are economic impact. And Honorable Aris, we did say that the National Agricultural Marketing Council is assisting us conducting that study. And once they are done, we will be in a position to come back and provide feedback. Also, even if Honorable Mteto said it's not necessary to respond, Chairperson, I just want to say that in terms of what is going on in the international world, if our honorable courts are going to grant permission that the farmers must have access to foot and mouth disease vaccine, we will never be in a position to probably export an ounce of our meat, because the whole world, 184 countries that we know of that are members of the World Health Organization, there is none or very few that may be there that allows farmers to buy foot and mouth disease vaccine and go and inject their own animals. And if that is the case, freedom of disease and managed control of the disease may not be in a position to be achieved. I don't know whether I'm answering Honorable Mteto on this one, but on the other hand, as members may know, how careful the department is in terms of assessing vaccines that are used in the country for foot and mouth disease. If I go buy vaccine anywhere else and come and inject my own animals, the likelihood of introducing disease is very high if we haven't evaluated the safety, efficacy, and quality of that vaccine. So we do believe that our courts are very rational. They will look at some of these issues and then be in a position to make the correct decision. Thank you, Chairperson.
Well, thank you very much, Dr. Della. I think we have come to the end of the responses. However, I want to say that Dr. Matisane, the issue that was raised by Honorable Trolley on the possible delays on the arrival of the vaccines, both from Biogenesis, Pago and Dolphin. Given the fact that Parliament will be on recess for the next week, we will still want to get appraised once we have received these vaccines, as you said, any time from now. So you'll have to do it in writing so that members of Parliament would know, even if we're not in Parliament, because we will actually be doing a constituency work also, and we will have questions asked as we go to the farms, to the constituency period, and meeting farmers and communities. So we would need to have answers on the issue around the vaccines and more information on the foot and mouth disease. We want to welcome the fact that the ARC, the Agricultural Research Council, now has produced these vaccines. We hope they'll continue to be able to do that. I don't know whether we have ARC here, but I know that we have the National Marketing Council here with us. Something I wanted, the one thing I wanted to raise, Doctor, is, which is the last one, is the issue around the identification, because you explaining how it's going to be done and how it's going to assist. My worry, and I think the worry of every member of the portfolio committee here, is when is it going to happen? I hear that when you start, you'll have to go to the community for public hearings and the like. But my question is, when? How ready are you, or how close to be ready are you as the department? It's very, very important. It must not eventually seem like you are reluctant to do it, because we would then want to know why are you reluctant to do it. Anyway, thank you very much for coming to brief us on the foot and mouth disease. We appreciate it that every week we get to understand what's going on. I may have forgotten to ask, when you were giving the brief on the provinces, and we welcome the fact that KZN seems to be getting out of trouble, and that you have given us the update on the other provinces, especially that you also have new infections in the Limpopo. I don't know whether you spoke about, because I heard you speaking about Limpopo and then Northwest, who seem to have new infections in some of these districts. I didn't hear you say anything about Mpumalanga. Am I wrong? Dr.
Chair, thank you, Chairperson, once more. Mpumalanga, there were no new cases that were reported to us, Chairperson, and maybe that is why we didn't emphasize it. But there are still some. The last outbreak in the protection zone is being attended to. So there hasn't been any new outbreak since the last outbreak in the protection zone. They are vaccinated already there.
Okay.
And then
Right.
related to the individual animal identification, Chairman may know that we had contracted the CSIR to develop a database for us. They have concluded it, so they are going to be handing it over to the department.
Great. You. Okay, thank you very much. My appreciation for the responses. At least I'm feeling better that we're almost there with the identification of individual animals, or individual identification of animals. I want us to go to the next item. Thank you, Dr. Mukajane and Dr. Modisane and the acting DDG for the presentation and the responses on the foot and mouth disease. Before we go to the next item, may I just check acting DDG as to where is DDG Komape, because this item falls under her responsibilities.
Thank you, Honorable Chair. As far as I'm aware, Ms. Komape is on precautionary suspensions, as far as I'm aware. I don't have the details of
no, that's fine.
Why she's on a precautionary suspensions. Thank you.
Oh, okay. No, thank you, because I haven't seen her in for some time now. So who's going to make the presentation to DDG? Let's go to the second item, Albertina.
Thank you. Thank you, Chair.
Go ahead,
Honorable
DDG.
Chair. And thank you, Chair. We have Mr. Kalembe, who is going to be supported by Dr. Simpiwe Ngangweni to give the portfolio committee progress on the amendment of the Agricultural Marketing Act. Thank you, Chair.
Okay, thank you very much. Dr. Ngangweni, you are welcome to this meeting. I saw that you were here. May I just check, is that you alone from the NAMC?
Good morning, Chair, Honorable Chair, and Honorable members. On our side, it's myself, but we also have the chairperson of the NAMC, Professor Yoste, online. I also have my colleague, one of the senior managers, Mr. Bonani Nyoto, who was part of the technical committee that was assisting the department with the initial drafting a few years ago. And then Mr. Kalembe from the department will be giving the overall updates. Thank you, Chair.
Okay, thank you very much. May I request the chairperson of the NAMC, if you are here, please greet the members here. You are welcome to the meeting.
Good morning, Honourable Chair and honourable members. Thank you for greeting me, and I look forward to the next discussion.
Okay, thank you very much. Go ahead, Acting DDG, with your team. Who is starting?
Thank you, Chair. This is Tembele Kelembe.
Okay.
I will be making the presentation. Next slide, please. Before moving on, let me not forget to say good morning to you, Chair, and honorable members of the committee and my colleagues. This is the table of contents what we'll be going through in terms of this presentation. You can move to the next one. And the list of acronyms, not too many, fortunately. So from time to time, we might be referring to the MAP Act, that is the Marketing of Agricultural Products Act, and OXLA would be the Office of the Chief State Law Advisor, and so on. Thanks, we can move to the next one. We are making this presentation to provide an update, as the acting DDG has indicated in response to the request from the portfolio committee. Next slide, please. Okay, by way of background, Chair and honorable members, I just wanted to capture where we're coming from. And that the issue initially was about making sure that we have some tool that will ensure fast tracking of transformation in the agricultural sector. And of course, that stems from the history of the sector going back years that resulted in this dual nature of the agricultural sector in the country. And the idea was to allow the minister to accelerate sectoral transformation, making use of the Act. Next slide, please. And the other shortcomings, of course, of the MAP Act that were identified was the role of the Department of Agriculture in the marketing of agricultural products was not clearly laid out, as well as clarifying the advisory role of the NAMC to the minister, clarifying the role of the council will be expected to play in agricultural economic research, and clarifying the appointment and role and responsibilities of the Chief Executive Officer of the NAMC, and empower the Minister to issue regulations on how industry trust funds must be used to achieve the objectives of the Act. Next slide, please. In terms of progress, Chair and honorable members, we'll start where it all started. Started back in 2020, and the NMC, as the CEO has indicated, was part of the drafting process. And those are the processes, the next few bullet points. Those are the processes that we went through in terms of making sure that we have a bill that is ready for tabling to Parliament. The most important, of course, being that we need to get the vetting of the bill from the Office of the Chief State Law Advisor to make sure that it is in line with drafting norms, and it also is aligns with the Constitution of the Republic. The next slide, please. The issue that came out when we got, there were various interactions, of course, with Oxla, but eventually the issue that came out as the major blockage to progress was what the Oxla identified as the constitutional challenge that the bill faced. It was not necessarily only the bill. What Oxla raised was that, well, even the Principal Act, you'd remember, Chair and honorable members, that this is one of those acts that were promulgated before the Constitution of the Republic. So, in a sense, it predates the Constitution. So there are these issues that they picked up, and chief amongst them was the fact that it talks to the implementation of statutory levies. And what Oxla then indicated is that we would need to, in any new bill that we are putting across, the issue of the statutory levels would need to be accommodated through a money bill, which is, of course, led by the Minister of Finance. And so any reference to the statutory levies in the Marketing of Agricultural Products Act would have to be removed. So that was the main issue. What the drafting team then did was to say, okay, in the face of this challenge, what can we do as the department to go forward? And three options were identified. And the first option was essentially a do nothing kind of option, which would only require that those issues that can be addressed through regulations be taken through regulations. But then, of course, that would not address the issue of the levies. And the two options number 2 and 3 would deal with the issue of the levies, in the sense that with option 2, we would opt for doing the amendment of the act, but make sure that then we remove all matters that relate to levies to be accommodated in a new money bill, as per Oxla advice. And then the third option was to say we draft a completely new bill, which at the end would result in the repeal of the Principal Act. This was to look at all the issues, clean up the act, to be a fresh act. Of course, also taking out the issue of the levies. The next. Of course, the option 3 would be the most, in terms of the drafting team, would be the most practical solution for the team. And this was, of course, the approval for the team to go ahead with option 3 was asked from the political principal. What that would also entail is that there would need to be a discussion, because if it is a money bill, the statutory levies are addressed through a money bill. The money bill, as stated, can only be tabled by the Minister of Finance, which would mean that the issues that relate to what the objectives of those statutory levies would need to be discussed with the National Treasury, so that there is a common understanding in terms of even the administration of those levies, how that process would go through. And that is a process that we have not yet finalized with National Treasury. In fact, it's discussions that we still need to undertake with National Treasury so that we have a common understanding and we address the issues that may arise out of the separation of the levies from the Act. So that whatever is done at the end of the day does not impact industry adversely, because you would remember, Honorable Chair and members, that since the deregulation of the marketing of agricultural products, control was the removal of the control boards and all that. There are specific functions that need to be performed nonetheless by the industries, and these statutory measures are the means by which those functions are done, and therefore whatever is done then in terms of separating those statutory measures from the Act itself would need to be addressed, and that is consensus that we're going to have to reach with the National Treasury. As I indicated, Chair, those discussions are still to commence with the National Treasury, and as soon as that is finalized, we will then move on with the amendment of the Act, taking into account those two processes, parallel processes that we would have to go through. You can move to the next slide. I think it will be the last one. So that is where the issue is, Chair. What we will be doing in terms of the next step is what I have indicated, that we need to sit down with the National Treasury and take it from there. So what it actually means, Chair and members, is that this Act is not going to be ready in the near future for tabling in Parliament. We need to go through all of those processes. I thank you, Chair.
Thank you very much, and good morning to you also, Temple. And thank you for the presentation. I'm going to allow members to ask questions, unless if the chairperson of NAMC and the CEO would like to make inputs. Please indicate so if you want to do so that I can then allow members, because we know that the legislative process is the responsibility of the department. So if you ever assist, you assist the department, not because it's your responsibility. But if you want to make inputs, before I allow members, Dr. Gangweni and the chair.
Thank you, Chair. I think at this stage we will, at least on my side, maybe wait for the questions from the members, and if there are any issues that we as NAMC will be required to respond, we will then do so, Chair. Thank you.
Okay. No, thank you very much. Honorable David, may I request that you switch off your mic and your video? Honorable David, please mute. Honorable Aris, Honorable Trolip, and Honorable Teto.
Yes, thank you very much, Chairperson. And thanks for the presentation. I just have one or two questions that I would like clarity on. The bill proposed to expand the minister's powers, and particularly over industry trust funds, the trust funds. What check balances will prevent political interference or misuse of funds? And then we would also like to know is how will the roles of the National Agriculture Marketing Council be strengthened without creating duplication or confusion with the department? And then we also would like to know the department estimated 4 million just for consultations. And how do you justify the cost given the slow pace and unresolved legal issues? They just need to give us clarity on that. And what assurance can you give us that the process will not require additional funding or further delays? And then my last one is how will the bill practically improve the market access for small scale and emerging farmers beyond policy statement? And then what risk has the department identified if this new bill and separate money bills are not passed simultaneously? And my last question is, we would like to know what immediate interventions are in place while the sector waits another 3 years for legislative reforms. Thank you, Chair.
Thank you very much, Honorable Aris. Honorable Trolley.
Thank you, Chair. I'm pretty much covered by Honourable Aris. It's a matter of concern that this initiative was embarked upon in 2020. It's now 2026, and we're looking at another 3 years. So it'll take it. Is it possible or conceivable that a change to legislation can take 9 years when the actual objective is to deal with shortcomings of this act and to improve transformation and to allow the minister to involve himself or herself in sectoral transformation? I think we need to be quite assertive about this as a committee. It's not possible that a bill takes 9 years. Thank you, Chair.
No, thank you very much, Honorable Trolley. Honorable Nyambos, and then followed by Bundalan.
Thank you, Chair, and greetings to fellow portfolio committee members. As I'm listening to the presentation, I'm taken back, and I would like to ask the question. Please take us into your confidence, in your knowledge. What was the rush of this bill or this act to be approved before the enactment of the South African Constitution in '96? I'm asking that because at that time, the country was in a transition. But between a transition, we're in a fundamental piece of or one of the pillar of our constitutional democracy was promulgated on the 8th of May. You already have an act that would regulate such that that act falls short of any constitutional amendment or inputs that were already established. Surely, if we can understand what was their rush, what were they rushing to, what was it that was so big that it was bigger than the Constitution at the time? Then looking back now, it's exactly over 32 years. And this industry or this act has been functioning in that untransformed manner. And now it's still delaying again. What could be really going on in this industry, especially that the industry is still running parallel processes where you have emerging on the parallel with the commercial industry. So which means even whatever input you are getting, you are probably getting from one end, because the emerging ones are still fighting for their entry into the industry. Once they are fighting, the established industry is already talking issues of marketing, how their products will be marketed. And I'm noticing here the deregulation of the agricultural regulatory bodies, which means there was a laissez-faire kind of operation in the regulatory bodies which were dealing with commodities, your potato, your grain, your citrus, and all of that. So they were doing whichever, they were operating without there is a regulatory body being in place. And so a lot is really questionable. But moving on, this industry trust fund, in my mind, I'm thinking, who are the beneficiaries of the industry trust fund? Could it be that the industry has set up a trust fund to benefit certain beneficiaries, and who are these beneficiaries? Could it be the previously disadvantaged communities wherein forced removal took place, such that to make way for the agricultural farms that are operating? Those are issues that I would like to ask and raise. Other than that, yeah, I think I've covered the question. Thank you.
Thank you very much, Honorable Nyambose. Honorable Ndalan.
Thanks, Chair, and good morning. Mine is that what support system are in place for farmers to adopt to changes in the Act? The second one, what are the main objectives of reviewing the marketing of Agricultural Product Act? How will the review impact small scale and emerging farmers? Thanks, Chair.
Thank you very much. Kelembe, you can respond.
Thank you, Chair, and honorable members. I hope I've captured all the questions. The questions from Honorable Aris, the first one relates to what checks and balances will be put in place if we want to have a bill where the minister will have more powers to drive transformation. The checks and balances, of course, will be built into the bill. The issue is not to have the minister in any way in control in terms of what those levies will be and how are they going to be distributed amongst who and who is not going to benefit. So those issues we will be taking into consideration when the bill is drafted. Even in terms of the existing act as it is now, the issue of the decision making in terms of how those levies are utilized are actually still within the respective industries. The only issue being that guidelines are given from the NAMC side in terms of how the allocation of those funds are to the different categories where they are utilized, whether it would be your research, it would be your the transformation, it would be your administration. Those guidelines are there, they have been set. So the onus, it is not for the minister per se to be the determinant in terms of where, how much goes to what. I hope I've addressed that one. And the issue of the estimated 4 million, that was just an estimate that we had to put through, because that was a request from the minister as well to say how much do you think this whole process will cost. What we anticipated there in terms of the costs was most of the money would generally go to the consultation processes, because we are going to have to do a broader and wider consultation with this bill, taking lessons, of course, from another bill that was before Parliament, and this issue was raised. And so that is it might be far less than the 4 million. But that is the estimate. That is not money that has been set aside now. It's just an estimate that it might go to that extent. The how small scale farmers will benefit. The whole intent of trying to increase or make sure that there is transformation captured in the Act is precisely to make sure that we bring those who were previously disadvantaged into the mainstream. That was precisely the issue that was driving the consideration of giving the minister more powers to drive transformation. Of course, that is something that is done with the existing Act. Like I indicated, there is a certain percentage of the levies that is geared towards transformation, and we have seen transformation happening even with that smaller allocation that goes to that. The intention was to try and fast track that, but of course it will be determined by how receptive it is to the broader industries and the small scale farmers themselves. The separation and how it's going, how are we going to align the issue of having a money bill that is handled elsewhere and the MAP Amendment Act handled by the Department of Agriculture. That is an issue, of course, that we would have to have the discussions with the National Treasury on in terms of how to align the two bills, because it would not help for the bill on the MAP Act to be passed before the money bill is in place, because of course that would have a devastating impact on the industries in terms of the revenues that they generate through those levies. So those are discussions that we are going to have in terms of how we align the two processes to go together such that we do not have that separation that would mean trouble for the industries. With respect to Honorable Trolip, the number of years it has taken for the bill, it has taken quite a long time. I totally agree. Perhaps the issue was the interaction. There were a number of interactions that we had trying to find a way of agreement with the Office of the Chief State Law Advisor as well, and getting to ultimately the point where we had to say there is no way we can get away from the separation of the levies from the Act. And there have been internal discussions in the department as well that have taken some time, but what I can say at this stage, I cannot justify the length of time it has taken, but what I can say at this stage is that as soon as we have agreement with the National Treasury in terms of how we take this process forward, it shouldn't take, because we have been through this, we do have a draft of a bill already. So it's not that we're going to be starting from fresh altogether in terms of the MAP amendment bill itself. So it shouldn't take way too long. But of course, one wouldn't want to be too optimistic in terms of the time and say 1 year we will be done. Of course, we'll work towards minimizing. We're not entirely tied to the 3-year process that we have focused. We will try and make sure that we cut as much as we can on that time. In terms of the questions that were asked by Honorable Nyambos, what was the rush for the bill to be approved before the Constitution? Honorable members, you will recall that the process of dismantling the control boards had started already. We did have an act before this act that was passed in 1996, which had dealt with the issue of the control boards. But because that movement had taken was moving forward at a fast pace, there was a need to make sure that we have an act that would deal once and for all with the issue of the deregulation of agricultural markets. So that was the issue that mainly drove the department to put forward or develop this new Marketing Act to take care of the changing environment with respect to agricultural marketing in the country. Yeah. The big issue, of course, is the whole issue of changing from a tightly regulated agricultural and marketing environment to an environment that is much more less regulated as it is at the present moment. And who are the beneficiaries of the industry trust funds? I will ask my colleagues from the NAMC to respond to that one, as they would have much better information in that respect, Chair. And what support systems? I think that was from Honorable Ndalani. What support systems are there for, I think, for smallholder farmers? I suppose that was in the new act. What support systems are we bringing in? Well, the support systems, the whole issue of talking the transformation is to make sure that we bring those that were previously outside of the system to the mainstream as well. And like I indicated, there is already, if you could go even to the act, the existing act, it talks to the marketing of supporting the marketing of agricultural products by all participants, not necessarily only those who benefited in the past, but making sure that we bring the new actors in to benefit from whatever provisions are there in the Act. That is the whole idea behind the transformation. Chair, I will ask my colleagues, I don't know whether it would be Dr. Ngangweni or Mr. Nyoto, to take the one of industry trust funds.
Okay, thank you very much. Mr. Kelembe, CEO, do you want to come in?
Thank you very much, Chair, Honorable Chair. Chair, I'm going to ask my colleague, Mr. Nyoto, to come in specifically on the question around the trusts. He runs that function within the NAMC. But before he comes in, just a general comment, Chair, to say, as the Honorable Chair has indicated earlier, that the department is responsible for the whole process in terms of its coordination. We appreciate having been invited to the technical drafting team, and which we were involved in. But there has been quite a lot of developments since 2020, and we would appreciate a continual or a chance to continue to be invited, because we believe we can provide quite valuable inputs based on the experience of implementing the current Act, Chair. Having said that, Chair, the question around the trust, through you, if I can ask Mr. Nyoto, my colleague, to respond to that. Thank you.
Please, Mr. Nyoto.
Thank you, Chairperson. Good morning, Chairperson, members of the committee, acting DG, Chairperson of the NAMC board, CEO, and colleagues. I thought, CEO, I would have a word on a couple of questions, but I don't mind responding only to the trust question. So we have trusts that inherited assets from the control boards and marketing schemes, and even liabilities for that matter. And those assets, when they were transferred from the control boards into the existing trusts, the founding mandate coming from engagements of the industry and the minister was that the established trusts will keep those assets evergreen, grow them by CPI plus, use the rental incomes or interests from investment portfolios to finance activities of the industry. That would be in line with the 4 objectives of the Act. So that's the first part. And members and chair, I'm sure when the committee receives presentations from the NAMC, you would realize that the industries that have big trust assets are the industries that are normally not collecting lots of statutory levies. So those industries will be using the proceeds from the trusts to finance their activities. The activities that are financed range from export promotions, product development, research, and a component on transformation that is aligned with the conditions of approval for statutory levies. So for any industry that collects statutory levies, there is a condition of approval that says 20% of the amount collected must be spent to assist in transforming the industry. And then we have, within the NAMC, developed the guidelines. The guidelines are synchronized with the Agri-BE sector code in terms of the pillars. And that all the trusts spend reasonable amounts on transformation. And I'm sure the chair of the NAMC board and the CEO wouldn't mind to invite you to see some of the interventions that have been financed, if that is not the problem. The second matter, Chair, that I would want to indicate, and perhaps as the basis of the lifting of the transformation from the legislative thinking, was that we have a system currently where industries, because of the guidelines, are supporting transformation. And transformation as a word, or perhaps either than being implied, is not put into the, is not in the Act. But the Act has been interpreted, and at least the NAMC, the department and industries have agreed on how this is done. I thought, Chair, and I hope I'm not misbehaving if I'm responding to the question as to perhaps why was the rush. I think the process of deregulation to some degree coincided with the completion of the Uruguay round of WTO negotiations. And Chairperson and members would remember that South Africa is a signatory of the agreement on agriculture of the Uruguay round, which calls a number of in terms of support given by governments to their sectors, directly or indirectly, and the protection that was the protection measures that needed to be reduced on the basis of commitments to that agriculture. I think amongst other reasons, the fact that we were readmitted to the WTO, that has just changed from being a GATT, and the commitments that we had signed in the Marrakesh Agreement would have formed part of the reasons. And perhaps an indication that the Constitution, if I'm not mistaken, was a legislation number 100 of that year, and the Act was 47, meaning there are a number of legislations that had been passed before the Constitution, not only the MAP Act. Let me end that, Chairperson. Thank you very much.
Thank you very much, Mr. Nguyen, for the responses, our appreciation. CEO, are you fine? Are you done on your part before we close?
Chair, thank you very much. I'm not sure if maybe the chair might want to come in, but from our side, we're done. Thank you.
Okay. Chairperson, is there anything you want to say before we close?
Thank you, Chairperson. No, I think my colleagues covered all the issues. I think there's just an appeal that the NAMC continue to collaborate with the department so that we create certainty in the sector when there's change. This is a very important sector in South Africa. So that is my only appeal. Thank you very much for the opportunity.
Thank you. Thank you very much, Chairperson and colleagues. Unless there's anything from colleagues here, honorable members, if there is nothing, I would like us to wrap the meeting. Okay. I saw that Dr. Mukhajani had requested to be excused. Anyway, we are at the end of the meeting. Colleagues, thank you very much for availing yourself for this meeting. We had a very good meeting. I just want to say that to the department, you must take this concern very seriously of this act, the amendments taking 9 years or so. It's not acceptable because if it doesn't, if it's not done on time, there are people who are affected. So please take it back and indicate to the DG that we've said it's not acceptable. But two, it's very difficult if the minister and the DG are not here, and then we also do not have one of the DDGs in the meeting, because when there is a need for clarity on issues that are senior, we do not then have responses. And I'm raising this in relation to the issue of the case, because Dr. Modisane struggled to respond, and he wasn't very sure whether he would be doing the right thing and the like. But if the minister and the DG were here, we would have gotten the response. We have accepted their apologies because we know what they are attending to. It's also very important for government. But it would have helped if DDG Sarafe was here, or any other DDG, so that we get the responses. It's something that we are going to raise with the minister when he comes, that if at his level and the level of the DG, they're not going to be in the meeting, we need someone also senior who can take responsibility of certain issues that are raised in the committee. Otherwise, I want to say thank you very much to all of you, from the officials in the department, and CEO and the chair and your colleagues in the NMC for coming through. We hope that these questions that were raised by honorable members of parliament and the proposals that they have made, you are going to take them seriously, because we can't wait another 3 years. And then on the issues of the foot and mouth disease, please do talk to your colleagues, Dr. Modisane, in the Agricultural Research Council, so that we can get those updates from them, written updates. so that we know what's happening in terms of what the issues that colleagues have raised, and yourselves also on the deliveries of the vaccines, the Virugenesis Bago and the other one, Solvet. We have raised a concern that if they do not come on time, we may have a problem. So please do send those responses. We will appreciate them, and pass our appreciation to the DG for having allowed you to come, and the Minister for having allowed you to come to assist us. Although we definitely want the Minister and the DG in our meetings every time. Colleagues, thank you very much. I think this is our last meeting before Parliament rises. We will then meet in the next meeting. May you all be blessed and have a very good Easter weekend. Those who are traveling to churches and those who are traveling home. I know there are those who are going to be traveling from the Western Cape to the Eastern Cape, those who are going to be traveling from the Western Cape to Gauteng and the like. All of you, may God bless you. Thank you very much.
Thank you, Chair.
Thank you, Chair.
Thank you.
Thank you, Chair.
Thank you.
Thank you, Chair.
Thank you very much.
Yes.